Welcome to the practical application for thoracic spine health. What we're going to look at today is some excellent stretches and some range of motion and functional exercises to help improve that flexibility of the thoracic spine. Now, what I want to tell you before we get started is that every body is different. Just as we heard in our thoracic spine module, that some of these exercises may be appropriate for some people, and it is up to you as the fitness professional to assess your client and to make sure that they are cleared by their doctor and also are not experiencing pain as they go through these exercises. So what we're going to do is either starting standing or seated. We're going to look at posture and scapula stability against the wall, which is why you see I have a nice blank wall behind me. So what I'm going to do is I'm going to back up right against that wall, stand up nice and tall, bring my shoulders against the wall, palms are in, and all I want you to do is lift the arms up and lift the arms, or bring those arms down. Good. Let's bring those arms all the way up. And what I'm trying to do is maintain contact with that wall, with the shoulders, with the scapula. Excellent. So what we're doing is just checking that posture. I'm going to take my heels and make sure that they are also on that wall. Just bring it up and down. Beautiful. Good. So that's our first thing. We're going to check that posture to make sure that that spine is not rounded. We're not engaging in that kyphosis. Beautiful. Now we're going to stay on that wall again. One hand on the hip, the other hand, if we can bring it up. We're going to take a nice little lateral spinal flexion, nice little reach. We can even use that arm to reach over and reach back. Good. So once again, I'd like to try and think about keeping those shoulders on that wall, because what's going to happen is people are going to start to lean forward. We want to keep that impeccable posture is what I call it. Let's switch arms. Bring that other arm up, reaching, really opening up that rib cage. Good. You're going to feel it through those lats, so latissimus dorsi. Good. All the way to the side and back. Let's do one more. Excellent. And bring it back. Bring those arms down. We're going to stay against the wall again, trying to bring both arms overhead and now stretching to one side. Good. Taking a deep breath. And exhale, bring it back to center. And now over to that other side. Get a nice stretch. Good, nice little flexion through that spine. And now one elbow at a time, keeping those arms up, bring the elbow down and up. There we go. What's happening with that back? Trying to keep that back on that wall. Good. Bring it up. Nice little stretch down, almost like a slingshot, pulling it down and back up. Excellent. See that again. And release. Let's go ahead and come off of that wall. I always say I like to do a little stretch. And what I want to get into is a little standing thoracic reaching and twisting. So we're going to bring those arms out to the side. Feet are about shoulder width apart. And the first thing we're going to do is just start to twist, keeping those arms out, almost like a helicopter. Now my hips are forward. I think of my hips as flashlights. Shoulders are flashlights, but those hips are going to stay in one direction. My head also is staying in that direction, rotating only through that thoracic spine. Good. So standing and twisting. Another option, bring those arms down. One arm at a time. I want you to just reach and twist as if you're reaching for something way across the table. Here, all the way across, all the way across. Good, very functional movements as well. Think about what you can tell your client as you do this. What are you reaching for? Are you putting something away? And now I want you to take this up and across. So we'll bring it up and across as if you're grabbing something from a high shelf and bringing it back. Reach, reach. Good. How could you make this a little harder with more strength? Maybe add a little bit of weight in the arms. It could be a water bottle. It could be a can of soup, right? It doesn't have to be something heavy. And now let's take this and reach across, all the way across. So again, nice twist through that thoracic spine. Think about what's happening in the core. Shoulders back, chest is lifted, abdominals engaged. Good. As you do this, what it is that you're doing, reach for that seatbelt. Pull that seatbelt across your lap. Good. There it is, keeping that chest up. Rotation, you're going to start to feel that right through the back, shoulder blades, scapula, and let's release. Good. Shake that out. What I like to do is always you do a couple, move on. Next up, let's get a little more thoracic exercise with hands behind the head. Now you can do this up against a wall. So it's great if you notice that you have a client who's always here, right? Or they've got lordosis, that wall is going to be your savior, really helping with that posture. And we're just going to lean side to side. What is the option? Again, this can be done seated. This can be done away from that wall, feet about shoulder width. So side to side. Now, getting into this a little bit more, what we can do is side and then center and then side. So what's happening? Really grounding, releasing that pressure from that thoracic spine, grounded. And again, also a fantastic core strengthening exercise as you work through the obliques, as you work through the rectus abdominis muscle in your stomach. Beautiful. Let's bring that down. Again, another option, sliding your hand down the thigh, one at a time. You can even add a little breath work with this. Take a deep breath in. Exhale. Inhale. Exhale. Inhale. Exhale. One more time. Inhale. And exhale. Good. And adding that breath work is excellent for reducing stress. And again, what I would like you to do right now, seated or standing, we're going to go ahead and put the hands behind the head. Before, we were doing that lateral spinal flexion. Now, what I want you to do is just rotate and then back to center. Rotate, looking over that shoulder. Notice the hips are staying forward. If you're in a seated position, same thing. Really isolating. So obviously, if you're seated, it's a lot harder to throw those hips off because you're in that seated position. But just rotating through that spine. And another option is taking one hand behind you. So I'm going to look towards my back hand. Look as I rotate. From a side view, it looks like this. Rotate and bring it back. Rotate, bring it back. Another option is bringing that arm down. And I'm following my hand with my eyes. Excellent. Another option, cross those arms. Same thing. I want a rotation through that spine, through that thoracic spine. Rotate and back together. Yes. Good. nice and slow. Again, assessing and reassessing your clients the entire time. So in addition, standing, we could have those hands here. They can be across. I'm going to start mine here. Feet about shoulder width. And I'm just going to round that entire back. Feel that spine kind of stick out, that vertebrae. And now we're just going to open up. Good, we're going to round. So if you're on the ground, we're going to try this in a moment, our cat-cow. So let's go. It's spinal flexion to spinal extension. Good. What I'd like to do with the arms is actually add some breathing into this. So maybe I'm going to pretend to dive forward. Inhale, exhale, open all the way back. Open those pectoral muscles as well. Inhale, round. Good, and exhale, open. What are some of the cues we're going to use? All right, we're going to open the shoulder blades, tucking the tailbone, belly button to the spine, and then open all the way out, elongate that stomach. Almost think of you're basking in the sun. Inhale, round. And then exhale, open. Good, releasing the hands. We're going to come down to the ground right now. And what I would like you to do, again, if you have a mat, fantastic. But we're going to start in a all fours position, quadruped position on that ground. Hands under the shoulders, knees underneath the hips. And this is our inhale to cow, arching the back. And then exhale, round to the cat. Good. So spinal flexion to extension, inhale up. Good. And then exhale, round that spine. Really release that pressure on that lower back. Good. Inhale to that cow. And exhale to the cat, really rounding up, holding here. Good. Now, what we're going to do is stay right here, bring the back nice and flat. So nice little tabletop position. And if you can, I'm going to take one of my arms. I'm going to take my right arm behind my head, and I'm going to bring it down and bring it up. So we've got a nice spinal twist. So bringing it down and opening. You're going to feel that right across your side. Also abdominal strength, but that thoracic spine is getting a nice twist. Another option, bring it all the way across and open like we're threading the needle. Bring it across and open, trying it with the other side now. Hand behind the head, bring it in and opening. Let's do that again. Bring it in and open. Good. Big twist to that core and open. And now let's try to thread that needle. Open it up. Let's reach it through and open up. Good. Let's do that again. Reach it through and open. One more time. Reach it through and open. Excellent. Let's bring it on to a seated position right now. I'm going to face the side. Sitting nice and tall. We're going to take a deep breath. Bringing that chest all the way up, nice flat back. Inhale. And then exhale, round the back. We say, show me that terrible posture, right? Now show me impeccable posture. Inhale up. And exhale, round. Good. Inhale up. One more time. Exhale. Good. Let's inhale right here, extending one leg, hugging the other leg. Placing it over the thigh if we can for that seated spinal twist. Again, option can just be here, but I want to try and twist, getting a nice stretch through that back, through the hips. Good, feel through the glutes. And then we're going to go ahead and switch. Bring that other leg in so we can sit up is your first option, crossing it your second. Third is that seated spinal twist. Again, knowing your clients, knowing their flexibility, knowing their fitness level is very important. Good, bringing it here. Now I'm going to lay all the way back, keeping my legs bent, keeping my arms out like a capital T. I'm going to take both knees to one side, trying to keep my shoulders, both of them on the ground, best I can. Giving yourself a nice stretch through that thoracic spine. And now let's bring it to the other side, keeping the feet together. Other side, big stretch. Excellent. And now go ahead and bring your knees into your chest. And I want you to just bring the knees in slowly and out. So we're getting a nice release on that lower back. Good, right up through that thoracic spine, in and out. And now open the knees and do the same thing. Good, bring it in and out. Excellent, bring those knees in right now, give it a nice hug. And slowly we're gonna rock up. And what I want to add is the roller. So one of the things that we talked about in the module is that I prefer rollers that have grooves in them. So this is exactly where your spine is going to fit. And what's going to happen is that these two raised portions are really going to get into your muscles and release. So I'm going to go ahead right now. I'm actually going to sit right on my roller. Make sure we can see. So I'm going to walk back very slowly. So some people think we need to roll very quickly, but we want to roll very slow. So just right up to about where your shoulder blades are and back, right through that thoracic spine. Very slow, releasing tension. Excellent. So that is how slow we should be rolling. Stopping at certain points, adding a little myofascial release, really getting into that fascia tissue. Good, supporting blood flow, supporting circulation, rolling that out. Now, another option with that roller is taking it and actually letting that roller, you can do this with a towel as well, and opening the body. So you can even open my legs. Good, so what's gonna happen is that we are stretching through that spine. We're letting our body kind of open as that roller elevates that spine. Good, so another excellent option, thinking about opening the chest, opening the hips as well. So some of the exercises that we just looked at today for the thoracic spine, again, are they perfect for everyone? No, everybody is different. And I need you to make sure that you're assessing your client, reassessing and assessing again, asking them, how do they feel? What's going on? And always getting that clearance from the doctor before doing anything. So those were just some resources. Again, in the module, there are a lot more resources and many other exercises you can implement, but hopefully those are some great exercises specifically targeting the thoracic spine. Next up, enjoy the next module.